Coming up next is the Dr. Kim Taylor Show. Here's your chance to talk about what matters to you. Although you'll receive helpful advice from Dr. Kim, remember this is not to be construed as any form of psychotherapy, diagnosis or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Kim by calling 564-1290 or 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. Now, here's Dr. Kim.
Welcome to the program today. We are going to talk about how to find help and support when and if you are ever faced with a serious medical diagnosis, and why it's so important in order to be able to find that help. Now, for anyone who has heard a devastating diagnosis or has sat in a medical office with a loved one, it becomes crystal clear to those around them that a patient's emotional mindset can either have a positive impact or a very negative impact on the person's overall health and prognosis. What we know for sure is that the mind and the body are interconnected. And as a psychologist, what's long been known is that there is this association between the psychological factors and the physiological processes that are going to influence our ability to handle stress or depression or anxiety. And all of this is going to have a huge impact on the immune system. In fact, the very presence of these issues of anxiety or stress or depression can really weaken the body's defenses in trying to fight a physical illness. Currently, it is reported that depression is one of the most common complications of chronic illness, and it's estimated that up to 1/3 of people with a serious medical condition, they also experience symptoms of depression. Now, the effects of the mind, both the ones that are conscious as well as the ones that are more subconscious, all of these can really dictate major factors that are going to be related to a person's ability to deal with the wide range of challenges that they're going to be facing during their illness. And this doesn't even include right now the kinds of changes that the family must go through when one of their members is ill. So with all of that in mind, I have a special guest, Dr. BETSY Bates-Fried. She's a clinical psychologist, and she specializes really in the intersection between physical illness and emotional well-being. She's also worked as a medical reporter and editor in numerous books on health and fitness. So she is here to talk about this very important role that psychologists play in helping to treat patients with chronic illness and in helping the family and friends that are trying to support them through this process. The last thing we're also going to talk about is the important role of caregivers and the support that they also need to be able to go through this process. So if you have a question or you would like to join in the conversation in some way, please call me at 805-564-1290, or you can also send me an email and we'll try to answer your question at drkim@drkimtaylorshow.com. I'm Dr. Kim Taylor, and I'll be right back after this short break with my guest.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
My guest is psychologist Dr. BETSY Bates-Fried, and she specializes in treating people with chronic disease or illness, and also in helping for the emotional well-being of all involved. And this includes the patient and the patient's family. So welcome to the program.
Thanks so much, Kim. It's so nice to be here.
Let's start out with really letting us know why it's so important, in your opinion, to seek out psychological help when you are dealing with a physical illness and why it's so important to be able to do that with a professional?
Well, Kim, it's an interesting thing. Obviously, rates of illnesses such as heart disease and cancer are very prevalent as we age. And you'll notice that some people adjust really well, even to very difficult diagnoses. They have really good support systems often and just a very resilient spirit and many, many coping mechanisms. So some people are going to do just fine, just working with their doctors and nurses. Others realize that even if they have met really intense challenges before in their lives, that just partly because of the physical symptoms and the toll that they are taking, but also the pressure on their families and on their identity, they just find that surprisingly they aren't coping very well. So at that point, I think it's really a good idea to connect with professional help. Now, that might mean a support group like at the Cancer Center. Here it's the Cancer Center of Santa Barbara. Other communities have their own support systems within the cancer centers. But it also might mean someone who's a psychologist, because we have special training in coping with the kinds of symptoms that might be affecting you: pain, sleep issues, anxiety, certainly depressive symptoms, as well as the adjustment things that other mental health professionals might be able to address. Finally, a psychologist has special training in neuropsychological testing. So sometimes the information that we can provide from testing about the course of the illness can really be of assistance to a physician.
There are also going to be a lot of changes, not just for the patient, but for the family or the caretakers that are going to support this person. So there are also a lot of ways that a psychologist can help deal with family changes.
Absolutely. I mean, when you think of the impact that an illness has, a diagnosis, there's of course the physical issue. Okay, you have this disease. This is what's going to happen. These are the treatments. So there's just the physical piece that physicians are so skilled in taking care of. But then there's the emotional impact of this. A lot of people feel sort of betrayed by their bodies. Mm-hmm. They can't imagine that this is happening to them. And sometimes they don't have any physical symptoms yet. So it seems a bit unreal. Then there are financial consequences, sexual consequences sometimes, spiritual questions that this brings to people. And all of this is affecting not only the individual, but their family. They have had a certain role in the family, a certain identity. And that may really be shaken up, and it can really rattle a person. And so I think that it's really important to see this in the context of the family system.
And what I find most often when you talk to somebody who is first learning about something that's going on with their body, and they're in the doctor's office, they hear the news, even if a family member is there, it's as if their ears kind of shut down. They go into kind of a shock, and they stay that way for a while because there is a lot of denial and not wanting to face it and not wanting to believe that this is happening to them. So it isn't just the illness that they have to deal with. It is the emotional impact that it's going to reverberate across time.
Absolutely. That's exactly what happens. And people are pretty familiar with the stages of grief. And they're very similar to what someone goes through and what a family goes through after a major diagnosis. And it's important to realize they might not be all in the same order or predictable, but in a way, you're grieving the loss of a healthy and dependable body and future. And so if you think of it that way, you understand why this feels so profound. People go through the numbness, the disbelief, the sort of bargaining. I'll do anything if this isn't true. The real difficulty making decisions that often need to be made pretty quickly. One thing I'd mention is that I really recommend when people are realizing that a regular medical test has come back with abnormal results and they're going to be seeing some specialists or having some tests, that's the time when you need to learn how to use the tape recorder on your phone or bring a tape recorder with you, a small one. They have them at Radio Shack if that's still in business.
It's not.
but I'm sure at any
there are other
office supply
places, yes.
stores. And that, or maybe you also want to bring a friend with you that's maybe not as emotionally wrapped up in this as perhaps your partner, so that they can be taking notes and asking questions, because often people tell me they never thought of really important questions until 10 minutes after they walked out to the parking lot, and then it's too late.
Well, and that's part of my point in trying to bring this up, is that most often people don't even know the questions that they are supposed to ask. And that is vital sometimes, because when you don't know what you don't know, it could be dangerous. And just as a side note, they can also use their phones and tape, because they can have an app for that, and they can just use their phones to tape a session, which would be fine too.
Absolutely.
With that, what and how maybe can psychology or psychologists, how is it relevant? What are the kinds of things that they can help?
Well, first, what we can do is help people understand that these really intense reactions that they're having are normal. They're not going crazy. This is not a sign that, whatever this is a brain issue necessarily. And so to kind of normalize and let them know that these are stages that they're going through, and that will settle down, and their own coping mechanisms will kick in. Then we can really help sit them down with good information, not just wild Google information, but really good information about their condition, often in connection with their physician who's part of our team, and help them explore what is likely to happen, what are the different options here, and basically what are the patient's values. Are these choices in accordance with the values that the patient brings to this? So you're not just Parkinson's disease or lung cancer. You're a person, and you see the world in a certain way. You have certain goals for your life, and those may influence the choices that you make.
As a person that's helping the family, you are also going to be closely working with their doctors, correct?
Oh, absolutely.
And what I do know is that doctors really like to have a psychologist involved to deal with all of the other issues that are coming up, because doctors don't have time to perhaps deal with the anxiety or the depression or the family issues that might come up throughout the illness.
And often they don't have the training. That they are trained in these issues, but primarily it's not a huge part of their training unless they're psychiatrists, in which it's a very core focus of their training. The vast majority of my referrals come from physicians, most of whom really want to work with me on, now this patient is going to need this. This is what it's going to look like. Here's how we can prepare them for that. I'm worried about this patient's depressive symptoms. What medications can be used that won't conflict or interact with the medications that they need for the physical illness. So this is why it's important to have someone who also can spend the time to let these issues unfold. The average physician visit is about 11 to 15 minutes. We all know that because we've all been to the doctor, presumably recently, and you know how quickly you get in and out. But the psychological visit is 50 minutes. And we can see patients more than once a week. We can go to their homes often. We can work with all the family members. We can sit down with children and help explain what's happening, help break the news to children. And so, it's just a very complex role that often families find very comforting and reassuring at a time of a medical crisis.
And something that you didn't bring up, but I know is also a huge component, and is that if a patient is depressed or anxious, it's going to greatly impact their immune system. It's going to greatly impact their ability to deal with the medical condition that's going on.
Kim, that is such a critical point. Research has been accumulating for a number of years that's very substantial and very convincing that depression and anxiety have a powerful impact on our physical health, and especially in times of illness. For instance, one of the best researched areas is depression in the context of heart disease, especially heart attacks. Now, depression is very common after heart attacks. There are physiological reasons for that. There are actual neurochemical changes that occur following a heart attack that help predispose people to depression, even if they've never had depression before. And this is the most key thing. If anyone has any take-home message here, if you know someone or you yourself is suffering depression after a heart attack, that is a very huge red flag that you need help for treatment of the depression, because depression greatly increases mortality, how likely you are to die. It increases the likelihood you may have a second heart attack. And this is even in the case when it's not severe depression. Even depressive symptoms have an impact on people. So cardiologists are really getting a handle on this and are referring patients with depression. And that's a wonderful thing, because it would be so terrible, such a tragedy, to survive a heart attack, get through that amazing thing, surgery, and then really what is most likely to undermine your chance for a good and healthy and productive life is depression, something that's very treatable.
What you can also do is help treat with anxiety, because there's going to be a lot of anxiety with all of this, whether it's just anxiety about taking the medications, anxiety about perhaps needing to go through some of the tests, or anxiety about who they are now separate from their illness and how other people are seeing them. So all of these factors are also very important to address for a person's general well-being throughout this process.
Absolutely. Anxiety can do many things. Anxiety can delay someone's diagnosis. They feel a lump or this cough does not go away, and they're really nervous about it. So they just deny.
Don't go.
They don't go. It's like
and they
if
put it off.
If I pretend this isn't here, it will just go away. So that's anxiety. That's what's at play right there. And so obviously that right from the beginning, even getting a person to medical care appropriately and early enough to do something about it is very important. Additionally, people can develop panic attacks in context of the medical procedures that they may have or scans they may have to undergo. In some cases, people who have been very successful in overcoming substance abuse problems can revert to that. It can lead to recurrence of substance issues because they're trying to numb out anxiety. That was something they used before. Sometimes anxiety can make someone unable to really fully comply with treatment. Mm-hmm. They're too nervous. They aren't thinking straight. They aren't taking the medication when they should, or they're avoiding going into the appointments that they need to have. Finally, both depression and anxiety play into feelings of guilt. And guilt is a killer. Guilt is it is not a helpful thing in the course of a medical illness. A lot of times medical illnesses develop because someone has been smoking, for years and years and trying to quit, or the family's been saying, you've got to quit, you've got to quit. Well, then something happens. There's a heart attack. There's a diagnosis of cancer. We can't do anything about the smoking that occurred before. What we can do something about is what's right in front of us. And
the feelings they're having about the guilt that they might have participated or contributed to this illness.
Or other family members are making them feel guilty. Mm-hmm. So if that's starting
or saying, I told you so.
I told you so.
I hate that.
And so you can just see what's happening in that family system that so needs to get cohesive right now. We need a team, to surround this person with support and figure out how we're going to accommodate this illness financially, every other way. And the team is broken apart by guilt and, self-reproach and that kind of thing. So that's a time when really a family should get some help, because we can't just, sprinkle magic dust and make guilt go away. But we can take it out and process it and see what we can do with that, and not pretend it's not there, but kind of put it in its place, fold it in the file, and put it in the cabinet, and let's get on with what we need to do now.
So the anxiety and the depression can also lead to isolation, feelings of hopelessness, even feelings of wanting to end their own life also. There is a lot that a therapist once more can help process, to help go through, to help make it normal too, to know that part of this is just normal. You are going to be feeling these feelings. They are going to come up, but you will be able to help them and the family to address how to deal with them.
Absolutely. And there are often things that the patient and family members are feeling, but they aren't going to say to each other or anyone else. And there's something that can be very therapeutic to go somewhere in a safe space where you trust someone and they've helped you make decisions and helped you through.
And it's confidential.
It's totally confidential unless there is a direct and, imminent threat to life or someone is harmed. To shut the door and say, sometimes I feel like this. And that's okay. Let's talk about that.
And what I find more often than not is just being able to say it out loud just takes all of the onus off of that and the guilt, and that just being able to admit that they're having those feelings, and it's just a part of their experience. It's not all of what they're feeling, but being able to relieve themselves by being able to say that is a really important part of letting go and moving on.
I couldn't agree with you more. That's exactly right.
So as I was doing some of the research for this and looking through things that you wrote about this, one thing that shocked me was that if you're having high levels of anxiety or if you're depressed, it can actually increase your pain.
This is true. This is true. And I don't think people realize this. They think pain is a separate thing in the body that from emotions, but actually they are on the same neural circuits. So the way they research pain, because you can ask if one person is an 8 on a scale of 10, that would be another person's 5. So it could sound like a really difficult thing to objectively research. So what they do is they do something that is the same for everyone. They often, in experiments, they use hot water. Hot water, there's a certain point where putting your arm in hot water becomes uncomfortable. And if the temperature is steady, they can make sure that it's the same for everybody. And then they do this with people who are depressed, people who are anxious, people who are neither anxious or depressed, just, normal, healthy volunteers. And they find that depression seriously increases not just the perception of pain, but the pain itself.
That's a very interesting fact. So it even speaks more highly about why to seek out a professional help and to deal with those kinds of symptoms, again, is just going to help the overall picture of one's mental well-being and their health. So we need to take a quick break. We'll be right back after the break.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
You are just joining me. I'm here with Dr. Betsy Bates-Freed, and we're talking about the importance of having support from a trained psychologist to help with the issues related to being ill or with the changes and the transitions that must be addressed during this time. So I think it would be really helpful for those who are either going through an illness or have a family member or loved one that is to discuss the ways that a psychologist can help the whole family and the issues that you would be focusing on.
Yes, and we with family therapy, we always start, like with any therapy, especially with group couples, with communication. Sometimes families who communicated pretty well over routine things in their lives, and even some crises that come along the way, in any family, this poses just such a special challenge that they really can't speak to each other clearly and honestly about what they're feeling, what their needs are, what the plan is, what the goals are. And sometimes you have to help a family come to united goals. There are some things, there's common ground here. Often what a psychologist will do is we'll go back and we'll take a look at other things that this family has dealt with. Maybe there was an ill child, maybe death of a parent, financial crises. And let's see what we did back then and how could we consolidate those strengths now and bring them to bear in helping move forward with this particular challenge. Sometimes illnesses just pose really difficult challenges that nobody is prepared for. For example, one of the things that we often see when someone has cancer is that both the cancer itself and the chemotherapy that's used to treat it can really impact someone's appetite. So what happens is you have the person, the family member who's losing weight and is getting weaker and thinner, and the people are looking and seeing that they're pale. And so what do we do as caregivers, particularly moms? This is kind of a mom thing. What do we do to take care of anything? It's the chicken soup, right? You want to feed them. If you find a baby bird on the sidewalk, the very first thing you do is you look for a worm. We'll find a little worm and cut it up and give it to, feeding and nourishing someone in need is a very human way that we take care of each other. So when a person is very nauseous or can't eat, and the family members are feeling like, this is what I'm doing to help this person, the rejection of the food can really feel like rejection of the person, or rejection of hope, or rejection of, any kind of health. And so that becomes a struggle. And it's a really terrible one, and I'm just citing it as an example of when, if your family was going through such a struggle and you weren't finding ways around it, and really hurt feelings were developing and anger, then that's a time when it would be a really good idea to get some help of sort of looking at the symbolic meaning of what the caregivers are trying to do and what the patient can't accept, and find some other ways to show that love.
And I think it's true that oftentimes the patient will take out their frustrations on the ones they love the most, and they can be even mean or angry, or there's a lot of feelings that are going to come out, and they get out in all kinds of perhaps displaced ways. But nonetheless, the caretakers or the support system is left to deal with these very hurtful feelings.
Yes. And it can also be the caretakers who are angry and who are getting, one of the things that happens in a really serious illness or a family crisis of any kind is that the structure of the family system is disrupted. If you think of a mobile that has, hanging from a child's crib, and each little button on it represents a different family member. If you came in with a strong wind and shook that up really hard, and all of those little buttons got destabilized and shifted, that's what happens to the family. Someone who had the role of the dad, the supporter, the strong guy, the guy who brings in the money, the one who's always, solid and stable and has the clear head. And that person suddenly is the ill person and needs to be taken care of.
And is no longer taking care of others.
Is no longer taking care of others, and hates asking for help, but now really can't do it without help. You just think of that one tiny little snippet of an injury to the family system, and you think, wow, that could become a powder keg. And no one means it to be. There's probably so much love in that family and so much compassion. But because everybody is in a different role that doesn't feel comfortable to them, it really can create a lot of emotional chaos.
And I think for kids, too, when they see their parents who are changing and they're suddenly having to become the parent to their parent, and that transition is a very difficult one to take on. So, again, help from somebody who is trained in the family dynamics, who can normalize what is going on, and to help each one of them to either express what they're feeling and or to help each other through this is a very important role that a therapist can play at this time in their lives.
Right. Even just identifying what were the roles and what are they now and what hasn't changed. I think that's a really key point. There are many things in that family that haven't changed at all. And if you can look at those and hold on to those, it's reassuring. It makes a family think, we may be in uncharted water here, but we're still in the same boat that we came across life as a family.
I think that's a very overlooked part. There are just a lot of positive aspects that you can hold on to, that something bad may be happening, but if you can look at the part that's good. That's really what's going to save you.
There's a tremendous amount of resilience and growth that happens in individuals and families. And almost every person with a serious illness I've ever worked with ends up saying that there were ways in which they changed their lives for the better that they would never change. That even if they could say, I never had this disease, they wouldn't choose that because it has been such a place of rebuilding of relationships, healing of traumatic wounds in the family, learning that a person has much more strength and resilience than they may have thought, seeing a family come together. These things are powerful and poignant, and they're the richness of life.
One of the things that you talked to me about was the fact that since you work one-on-one with a lot of people who are going through this, that one of the things that you were just blown away by is how resilient, how much people can actually endure, and how much life is really in a person when they're pushed.
It's so true. It's so true. I think we all say to each other sometimes, well, I would never want to live if that happened. I would never want to live if I had to have my leg amputated, or I had to have, that I had to have some sort of a stoma or this kind of thing. Well, you know what? There are people walking around down the streets that you meet every day who are living with pretty amazing things and doing just fine with them. And I bet they all said that before too. People don't realize how much they can handle.
So there are a lot of different places within a person's transition and through the illness or the family's changes that a professional can really come into the mix. So whether it's at the beginning, the middle, or the end, or with those that are left behind afterwards, what have you found to be true with those that do seek help from a psychologist?
I think one of the things is that there's relief before the first appointment ever happens. I think when they make the phone call, there's something about it of like, I'm not going to be completely alone with this, or our family is going to maybe get some help here. And just that helps people. Then I think when they actually get into having an objective person who can confidentially help them sort through decisions and information and feelings and everything like that. I don't think it's like a hallelujah kind of moment. I think it's a quieter realization that they're feeling a little less overwhelmed, that they're feeling like this is all going to work out, that they can actually look in the eyes of the person that they love and say, I do really get irritated sometimes and this is kind of overwhelming me, but I totally love you and there's, I wouldn't take this time back together for anything. There are these really beautiful moments like that. And I think it just gives people a sense of control.
Mm-hmm. And hope.
Definitely hope.
And hope.
Absolutely.
All right, we're going to take a quick break and I'll be right back with my guest.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
My guest for the hour is Dr. Betsy Bates-Fried. She's a psychologist specializing in treating patients with a chronic or life-threatening disease. And we're talking about how to gain support from a trained professional who can really help you and or your loved ones to go through this process. So when do you need to, or under what terms? Because I know for perhaps cancer, that would kind of make sense, that you would want somebody to help to step in to go through that process, maybe the heart disease. But what are some of the other things that people should consider in getting some help from a psychologist with?
Well, if we step back and we think of some things that might not seem obvious at first, things like asthma, COPD, things that affect your very ability to breathe, that may come on unexpectedly and create emergency, urgent situations that are life-threatening. Those kinds of illnesses really contribute to anxiety, not just among the person, not just in the person who has them, but among family members. Something like stroke, where someone is one way one day, and then they're suddenly the next day they're losing significant abilities or appearance can be drastically changed. That can also happen in a serious accident. Something like diseases that occur during adolescence, developmental stages that are challenging anyway. And so if you have an adolescent with cystic fibrosis or an adolescent with serious depression or something like that, then that adolescent really, that family might need some extra help. Infertility issues, miscarriage, things like that. And certainly a big one that I think is increasingly getting attention is dementia. When someone is at the early stages of dementia, Alzheimer's disease, there's an awareness that their mind and their identity are slipping away. So that is terrifying to people, and it's also very unnerving to the people around them who are completely switching their roles with that person.
So just list some of the ways that a psychologist would step in. It would be perhaps with the family therapy or couples therapy. What else?
Absolutely. It might be family or couples therapy. It might be very streamlined. It might be that someone is getting panic attacks now, and it's very difficult to comply with radiation therapy because they know they're going to panic. The situation triggers it. And so it might be very specific therapy aimed at something like that. It may be very specific research, evidence-based treatment for PTSD. A lot of these illnesses create PTSD. And also end-of-life issues. As the goals of treatment change from cure to having compassionate end-of-life care, that is a tough transition for a family, and that's something that psychologists are very good at helping a family to manage.
Currently, I have a friend whose life has really been turned upside down as she takes on the caretaking role for her husband who has been diagnosed. And the last thing she's really thinking about is her own health and her own well-being right now. But talk to us about how vital it is to really acknowledge and focus on also helping the caretakers.
Well, something that people don't actually know very widely, Kim, is that the caregiver's health, not just their mental well-being, but their health may be at risk. In fact, there's been research that with some kinds of cancer, like prostate cancer, the caregivers of prostate cancer patients actually have higher levels of depression and anxiety even than the patients themselves. And this can translate and does translate into diagnoses of illness themselves. So, yes, a caregiver is taking on extra jobs. They may be working. They may be having to struggle to pay the bills. They may have never paid the bills before, and they are. Then they're dealing with all of the household needs. There needs to be a meal on the table. The children need to be cared for. And so they may think the last thing in the world that they could have time for are their emotional needs. But those emotional needs are critical not only for their own health, but because they need to stay strong for this person that they're taking care of.
So what kind of resources are available out there to the caretakers?
There are many, actually. I mentioned our cancer center here, the Cancer Center of Santa Barbara, which has support for caregivers. Individual psychologists like you and me provide that kind of care. And then there are specialized support groups some of them are for patients with dementia, some of them are for patients with Parkinson's disease or other illnesses. And so then there are hospice caregiver support groups that are very good as well. So I think it's really important to do a little research and find out what is available in your community. There's a lot. If you cannot get out of the house, there are caregiver resources that are strictly by phone. There's a national radio show that a local psychologist here produces, and she talks to caregivers from across the United States on the phone at night, and they can just get a little support that way. So don't think that if you can't get in your car and spare an hour that you can't get help. You can.
Great. And I will put and post those on my website at the end of the show, too. Most of us really do accept that a huge component to a person's overall well-being is really to understand that mind-body connection. If our mind is not in the right place, then everything else can really suffer. So tell us a little bit about how you're working to help doctors and patients to understand this.
Isn't it funny that we think they're separate? Mm-hmm. You know, the ancient
because
Greeks,
they're connected. It isn't like we go and pick up our head each morning, right?
No, they aren't. It's so funny. The ancient Greeks had this right, and they really believed that there was a seamless flow between the mind and the body. And the more research we get about neurology and the way the brain works, the more we realize that they are connected, just like the pain studies I mentioned. Pain is not something of like, oh, that's just in your head. Well, all pain is in your head. That's where pain originates, whether it's physical pain or emotional pain, and they look exactly the same.
If we're to take this one step further, that under the umbrella of caretakers is also really the need for professionals to also sometimes seek care for themselves when they're dealing with people that are coming in who are ill, and sometimes the burden of that. You have a book also that you say that is very good for that.
Yes, there's a book called When Professionals Weep that I have found to be very useful in my own work with people who are facing pretty intense life transitions. And the book is filled with interesting articles about nurses, physicians, people who are other members of the healthcare team that, work with people sometimes at their most difficult moments in life and as they transition out of life, and how their own reactions to death or their own backgrounds can be influenced and can actually lead to burnout if they're not addressed. And so that's a book that I would recommend for people who do a lot of caring of folks that are in this situation.
Well, I want to thank you very much for being here, and also for the work that you do of really helping to improve the lives of people who are going through a very serious illness in their own lives, because I certainly know that the people that go to you do a lot better.
Thank you so much, Kim. Thank you for having me to talk about what's a very important topic.
Mm-hmm. Well, thanks for being here. I will also leave your contact info on my website so that people can go to the Dr. Kim Taylor Show and look up guests, and I will put Dr. Bates' free number and your website on there too.
Excellent. Thank you so much.
All right. I'll be right back with some closing comments right after the break.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
Thank you for joining me today, and I really hope that this show has helped to educate you as well as perhaps inspire you to reach out and ask for the help that is there when an illness may strike. Whether you are the patient, a family member, or a caretaker, psychologists can help you navigate the often very scary and daunting road ahead, and together you can find the answers that are going to be helpful to you. More often than not, I have seen angels come out of the woodwork to help, to assist, to support and love people through some of the most difficult periods of their life. So I do really encourage you to be open to receiving the help in all its various forms. I will also make the resources on my website for caretakers. Just go to drkimtaylorshow.com and they'll be listed there. Thank you for joining me. I will be here again next Thursday afternoon right here at KZSB AM 1290 live at 5, and I hope that you'll tune in then. You can also listen to the rebroadcast Thursday evenings at 10 p.m. and Sunday mornings at 9 a.m. And now you can go to iTunes and download the podcasts and listen to them whenever it's convenient for you. And don't forget to check out my YouTube site on other topics. Be well. Until next week, I will be back here next Thursday live at 5, so I hope you will too. I'm your host, Dr. Kim Taylor, and remember, nobody else has to change in order for you to feel better.